For me, this is my first time at a clinic.
Yay!
I know. I've been working behind the scenes with our teams back at headquarters or whatever. But for me, it was a bit like, you know, when you read a book, but you don't really, like, you've got all the imagination in your head, but then you see the movie and it's like it comes to life.
Totally.
It's a little bit like that. And I love what you just said about the people who are here on their own time, contributing in this way. And I just think it's not even a partnership. It is actually, this is a team sport we're doing here.
Yeah, totally.
This is something we couldn't have imagined, you know, 2 years ago that we'd even be having this conversation. And yet just seeing people come together to experience this together. You also see people leaving the clinic after they've just received their vaccine. And I mean, they were going out the door with smiles on their faces, right? Like,
they totally were.
I'm going home vaccinated, you know, and I think that's really special that we can do this of all things together in this season.
And that's really the essence of why I wanted to talk with you today, of just that togetherness and realizing that there's an opportunity in our city to invest in a different way, in a new way that perhaps we had never thought about before as a church, and then as IH, maybe they never thought, well, hey, we're going to do this in a church as well.
Yeah. No, and it's funny, right? Because I mean, for the past 5 or 6 or 10 more years, people talk about how there's fewer and fewer people coming to church. Enter 2021, and actually, like, we got loads of people coming through our doors and feeling comfortable here and actually coming for something really monumental.
We were honored when Interior Health approached us to partner, and that they were able to see us as a willing listener to a potential opportunity, and how we can come along and serve together. And that's really what we're talking about this weekend, is serving our neighbors. And how have you seen that through this time?
So, you know, Trinity was approached because of a lot of reasons, obviously space and parking and all those things come into play. And being a willing partner is definitely part of that as well. But it's also just really simple. Like, there's an element of it super complex, and then there's just an element of simplicity of, we know we've got to do this. And I think at this moment in our pandemic here in Kelowna, in BC, we're ready to do something. Each one of us is ready to move this forward and to move forward in our journey in the pandemic and really see some positive impacts. And this clinic vaccination campaign, what a great opportunity.
Yeah. Many of our faith community were like, I need to do something. I need to get out and serve. And not being able to do that for so long, we now have a waiting list of individuals who want to participate and who want to come alongside and just give back and participate in what's going on here.
You know, I'm so encouraged, not just the people who are volunteering at the clinic, but when I hear about people who are supporting those who are perhaps self-isolating or who are not able to leave their homes or get out as much. You know, there's some really creative and neat ways our community is connecting, whether it's digitally or what. It's just really encouraging. But I think we also all have this really great opportunity right now to share with each other the good things we see. We were chatting about the bright side and how that is you know, something my family looks forward to on a regular basis. And I think it's just because we have this thirst right now for both participating in something positive and seeing the positive. And it's such a great opportunity for our church.
You know, and you say our church because although you work for Interior Health, you and your family are part of Trinity, actually, right?
We are regular attendees at Trinity since 2017. So we've really kind of gotten into a great rhythm. You know, I go to She Cafe, my kids went to youth group. We've got 2 teenagers who are really plugged in that way, and 2 younger kids as well. And then the pandemic hit, and like all families, it was, here's some family time for you. And really actually for us, because my husband's a teacher, the 4 kids and him were home for about 3 months, 4 months straight, you know, just them. And I was at work for about that same period as we were really in the thick of responding to the pandemic initially. So yeah, it turned our lives upside down, but we've kind of adapted. And one of the things that's become our regular routine, I think we might have missed maybe 2 Sundays of church in the past year and a bit, which way outshines our previous record. You know, I mean, it's just, we've kind of got this new rhythm where we still do church Saturday nights, but now the dinner table's right there. So food's in the oven, and we come around the table after church and we can talk about it. I think there's been a lot of stuff that's really tough about the pandemic that we've experienced, but there's been a lot of stuff that we've enjoyed too, and been really able to see new ways of doing things and share. Like, we share church more. We send links to our family or friends back in Ontario and say, hey, look at this great message that we heard last week. And it's just kind of neat that you can share that experience in a different way.
That is awesome. And I can't agree more. I think it's, when you can watch church in your PGs, or you can do it eating supper. There's something about that, right? That communal aspect of what's going on.
We did Easter in the backyard with friends, and this is like pushing the envelope for our family, right? We're like, well, this is, kind of intimate almost, right?
Yeah,
like
totally.
that you're doing it. But everybody stood up and sang, and it was actually really fun. We had a really great time and connected on a different level with people that we would have seen at church on a regular Sunday, but it almost made it more special. So
I can only imagine.
Shout out to our friends.
No kidding, Rick. Way to do that. And you even told me like one of your kids is like the worship leader in the household.
Like our youngest, like if you're recruiting for worship leaders, she's 8.5. She's down with it. Like, she knows the words, and she's just the one that sort of pumps us up at home, and I think the connections that the kids are making through the kids' church, and it's just been a really different way of doing it, but actually kind of fun.
Yeah, totally. Jen, you're in communications with Interior Health, and I can only imagine the complexity of what that's involved for you over this season. How have you been able to manage that?
I think we get a lot of questions, whether they're coming in as emails or on our social media inboxes. Sometimes they come through other leaders, elected leaders in the community, and we do a lot of work to try to get information out and answers to those common questions in particular out. But it can feel like an uphill battle, honestly, because you want to be able to get vaccine, for example, to as many people as possible. You want to be able to make the guidelines as clear and simple as possible. And the reality is we just live in a really complex world. And there's lots of things to consider. And we also want to make sure we're interacting, that meets your needs.
Yeah.
And that's in a personal way that would meet my needs. And so it makes it feel a bit hard, but I think as a comms team and just as our team at IH, like we share a common goal and a common purpose. And that is really to be providing the best services, the best care, the best quality healthcare in a pandemic, vaccine as best we can, as quickly as we can. We share that purpose across IH, and honestly, we're so grateful. On behalf of my CEO, even, like she sends her thanks and appreciation when we can actually share that purpose with others in the community as well.
So Jen, one last question for you. With all your expertise and all the things that when are we all going to be able to get back to where we were pre-pandemic?
Well, that's a great question, Scott. And I watch Dr. Henry all the time. I know, you know what? I don't think that's the question that we should be asking ourselves, honestly. Like, we need to ask ourselves, what can we do today to get us closer to that point?
That's so great. Well, hey, I'm so grateful that you joined us today. It's so good to see you in person, and I look forward to more things to come.
Thanks very much.
Yeah.